Okay, we'll get started with some housekeeping. In order to be more accessible, we have enabled closed captioning. Look at the Zoom toolbar to turn on closed captioning in your view. You may need to click the three dots that say More to see the closed captioning option. Ms. Rowe and Ms. Abraham have no relevant financial relationships. Without further ado, I will introduce our presenters for today. Mia Rowe is the Communications and Outreach Coordinator for the Louisiana WIC program, where she coordinates internal and external outreach for the LDH Bureau of Nutrition Services. She also creates WIC-specific content for the Louisiana WIC website and social media. Mia has a Bachelor of Science in Community Nutrition from LSU and a Master's of Public Health from the LSU Health Science Center. She was born and raised in New Orleans, where she lives with her husband, 2 dogs, and 2 cats. Patty Abraham is the Nutrition Education Exempt Formula WIC Farmers Market Manager for Louisiana WIC. She is a registered dietitian nutritionist and certified diabetes care and education specialist. Patty received her Master's of Public Health from New York Medical College and a Bachelor of Science from SUNY Stony Brook. Prior to her position with WIC, she worked as a renal dietitian and has 15 years experience as an adjunct professor at Arkansas State University and New York University. I will now pass over control to begin the presentation.
Alrighty, I hope everyone can hear us okay. And thank you, Julia, for the introductions. So before we get started with our presentation, we are gonna have a couple questions at the end just to kind of get y'all's feedback. So I'm not sure if anyone's familiar with Mentimeter, but it's super easy to use. And there's 2 ways to kind of access the questions that we have. So you can either go to menti.com and use this code right here, or you can use your mobile device and use the QR code to access it that way. So if you want to quickly get on now and just kind of wait it out till the end, we won't ask the questions till the end of the presentation, but just a little heads up, and I will also show this information later on for you as well, if you can't get it now. But that being said, we're gonna go ahead and get started. So this is kind of a comprehensive guide to the Louisiana WIC program. And once again, my name is Mia Rowe. I'm the Communications and Outreach Coordinator for the Louisiana WIC program.
And I'm Patty Abraham. I am the Formula Manager.
Alrighty. And just some of our learning objectives, like Julia mentioned. So we want you guys to be able to relate to patients the eligibility requirements, application process, and some of the available resources that we have at the WIC program. To demonstrate how to correctly fill out our WIC 48 medical request for formula and or food, and also to apply understanding of the differences and limitations of our formulary to your practice. So I know most of you know about the WIC program, but just a little overview. So the Special Supplemental Nutrition Program for Women, Infants, and Children, or WIC, is a supplemental nutrition program, which is important, meaning it kind of supplements the food that mothers and children eat. So, and we provide appropriate health services, assessments, education, and certification for WIC, along with supplementing nutritious foods via an EBT card, and also referrals to other healthcare social services. And just some of our eligibility requirements. So in order to be eligible for the WIC program, you have to be either pregnant, and then breastfeeding women up to 1 year, and non-breastfeeding postpartum women up to 6 months after delivery, and then as well infants and children up to 5 years old or up to their 5th birthday, including children in foster care. And this is something that we definitely want more people to know about, is that children also do qualify for WIC up to age 5. A lot of people just think it's mothers and babies, but it is in fact children as well that can qualify for services. Participants must live in Louisiana. However, we do not require proof of citizenship or alien status. So this is good for a lot of limited English proficiency participants or participants that may be uncomfortable to provide this information. Income eligibility, obviously they have to live kind of below that 185% poverty level, but participants who are already qualified for Medicaid, SNAP, or TANF are automatically eligible. So that's something also that we work really hard with to kind of let people know that if they are already a part of any of these programs, they automatically qualify for WIC, and it's super easy for them to get started. And then last but not least is their nutrition risk eligibility with medically based risks and dietary risks as well. All right, and some of the services we offer, like I mentioned, the supplemental healthy foods. It includes fruits and vegetables, whole grains, dairy, some meat options, and then infant formula and nutritionals as well, and some other options. And we have breastfeeding promotion and support, which Patty will get into later in the presentation. We also offer nutrition education, and depending on location and clinic, we provide general and individualized nutrition education classes as well as online education through wicchealth.org. And then we also offer referrals to other services, including referrals to our breastfeeding peer counselors, immunizations, high-risk nutrition assessments, substance abuse, domestic violence, and any other referrals that we can offer. So this is something new that we've launched in the past year or so. So this is the MyWIC app, and it's really helpful for participants to use to take advantage of all of the resources that we have. So with this app, they can scan items in the grocery store in real time to find out if they are WIC approved, which has been really helpful for a lot of our participants. They can also manage their appointments, so they can make certain appointments, they can upload documents, which makes it also easy for them not to have to bring so many things to their appointments. And they can also keep track of their benefits in real time as well. As of February 1st, we had about 61,000 users of the MyWIC app across mobile and desktop devices, which is really awesome. We've seen a lot of growth in that app in the past couple months. The one thing is they do have to be WIC participants to use this app. So they do have to be certified and have to have a number in order to access it. But yeah, we've seen a lot of growth in this app, and participants seem to really like it. And the last thing is we do offer resources for our participants that you guys can kind of help out with. So we have outreach brochures that we can offer your hospital or clinic or wherever you're located. And we have this brochure. This is kind of our main one. This is our outreach brochure. But we also have tons of other promotional materials, like we have lots of breastfeeding materials, other just WIC resources that we can offer you guys if you ever wanted them. So you can either reach out to me, my email's at the end, or we can get you connected with your closest WIC clinic or your regional nutritionist, and we can get you some materials that way. But also, kind of for participants, we really, 2 ways we kind of ask them to get more information or to apply for the program is to either go on our website, LouisianaWIC.org, or to call our toll-free baby line, or even using the MyWIC app is a good way to kind of get started with WIC. And so that's all that I have, and I will turn it over to Patty for the rest of the presentation.
Okay, good afternoon, everybody. Can they put in the chat if they have questions?
Mm-hmm.
Okay, so feel free to put any questions you may have in the chat, and we'll try to answer all of them. For a lot of families, they think of WIC as, the baby milk, the place to get your baby milk. But we also provide a lot of breastfeeding support, promotion, encouragement, and we want moms to recognize that breastfeeding is the best for their babies. And after I talk a little bit about the breastfeeding and support, we'll go into our WIC formulary and the WIC 48, which I'm sure several of you are familiar with. So as I mentioned, we really do encourage breastfeeding as the preferred method. All pregnant women and postpartum women are referred to our breastfeeding peer counselors and provided breastfeeding information. So the peer counselors, each clinic has a breastfeeding peer counselors. The requirements for them is that they have to have been a WIC mom and they have to have breastfed for at least 6 months. Also, clinics are encouraged to promote breastfeeding by having, you know, signs up, posters up, banners up that shows, you know, how great breastfeeding is. Several clinics have breastfeeding rooms. Some of them are very comfortable looking. And clinics are not allowed to have anything that promotes formula. This could be the actual cans of formula. They can't have pens or notepads or anything that promotes formula. And so some of the support that is provided to participants, as I mentioned, is that peer counselors. We also have the IBCLC, or the International Board Certified Lactation Consultants, that are available to our participants. Breast pumps are available to qualified moms. We have 3 different types. We do have hospital grade pumps. Those would be issued on a monthly basis, and that has to be returned, but they're all given obviously new tubing, clean. We also have electric and manual pumps that are given to moms that would need that. Another thing that we're excited about, in addition to the MyWIC app, is what we have is the Pacify app. The Pacify app is available to all WIC eligible participants. It allows a mom 24/7 to contact a breastfeeding expert. They can do a video call, they can do just a talking call if they're not comfortable. And this 24/7 is awesome. The majority of the calls do come in after the clinic is closed. And it's just very well received. It's such a great resource for moms, you know, at 2 in the morning that are having this issue. And they also have, this app is available for English and Spanish speaking participants. So if for participants, if they're not in WIC and want to subscribe to this Pacify app, it's quite expensive. I've heard $50 a month or $100 a month, but our participants get it at no cost. Okay, so this is a screenshot of our website, and if you have your phone in front of you and want to follow along the different resources I'm going to be going over, you can scan this QR code. But all the resources for our medical providers are found here under this tab. It's the WIC community. The first option is for WIC medical providers. Okay, some of the resources that I'll be going through today is our healthcare provider guide, the formulary. Okay, so I guess I'll answer this question because I could read it. Can they get onto Pacify before they're certified? The answer is no. They do have to come in and be certified. So as Mia mentioned, WIC is for pregnant women. So they could, as soon as they're certified, they would get the code to their clinic and be able to use all of the resources for the Pacify app. In addition to that, we also have monthly Zoom meetings or breastfeeding support groups that are available to moms also. Okay, so backing up here, the resources that I will be going over today include our provider guide, our formulary, the documentation that's necessary for the lovely WIC 48, some different ICD codes, and then the qualifying conditions that I'll get into with the exempt formulas. There's a couple things I'm not going to go over. One is a one-pager on how WIC helps participants, and also a breast pump guide with some questions and answers. And recently we have updated our healthcare provider guide. So a lot of what I'm going over would be in this healthcare provider guide. It's about 9-10 pages long. We have our table of contents there. If you access it electronically, you know, it's interactive, or you could click and get to different locations. we're very excited about that. Mia did a great job. Okay, the next document I want to go over is our formulary. There's two locations for this. One of them is you actually click on the formulary. The other one is the back of the WIC 48 lists the different formulas that are available. So this is the formulas that are available to WIC participants. Some of them would require prescription, some do not. The first page are our standard infant formulas. And as you go through the different pages, we have our exempt formulas. We have 21 exempt formulas. They are also categorized from premature, post-discharge, hypoallergenic, amino acid base, and special formulas. The last few pages are the nutritionals. This is what we call what would be given to a 1 to 5 year old that is certified in WIC. These include things like the Pediatric Growing Gain. There's some enteral products, Pediatric enteral, and then like the junior versions of the Alpha Nino, Neo-K, Elecare. So on this form, you can see the name is in the first column. The second column has the form that's available, either powder, concentrate, or ready to feed, and then just a brief summary of the intended use. So these are the standard formulas that are available. So we are federally mandated to have a contract with the formula company for our standard formula. It has to do with cost containment. There's a rebate process involved with that. And if you refer to that first sheet, you can see the different forms available. So the advanced and the soy are powder, concentrate, and ready to feed. Total Comfort is only available in powder, so that's all we have. And then Sensitive has powder and ready to feed. So for each of these standard infant formulas, a mom can come in, get certified, and any of these would be available to her. There's no prescription or WIC 48 required for infants. If a child needs to be on an infant formula, it would require the WIC 48. They all have 20 calories per ounce. All of our WIC formulas have to contain iron, and all of the standard formulas are nutritionally complete. And just to give you an idea for how much a infant will receive, as Mia mentioned, you didn't mention that, but anyway. So for a fully formula fed infant from 0 to 3 months, they would receive 9 cans. We only issue the smaller cans because we cannot over issue, and that would happen with some of the larger cans. So from 0 to 3 months, they would get 9 cans. From 4 to 5 months, that goes up to 10 cans. And then for 6 to 11 months, it goes down to 7 cans, but that's when we start adding the infant cereal and the infant fruits and vegetables, and they do receive 32 of the 4-ounce cans, 4-ounce jars of the infant food. And what I was saying, what Mia mentioned, is this is a supplemental food program. So if there is a situation or infant that needs more than is provided through WIC, then that would have to be purchased through SNAP dollars or other funds that the families may have. We recently added Total Care 360 and Total Care 360 Sensitive. This got a lot of people really excited. However, these are only available on our formulary and ready to feed. I'm going to go over a little bit later on the criteria for ready to feed to be issued the standard, a standard formula that's ready to feed, and also an exempt formula that's ready to feed. Okay, so in a situation where an infant does not tolerate the standard formula, they would need to be issued an exempt formula. All of our exempt formulas require a WIC 48 or medical prescription. I'm going to go over in detail the different sections of this and sort of the pain points that could be experienced for you filling it out and for our clinic getting it, and there's some discrepancies if they're not able to accept the WIC 48. And I'd love to hear some feedback from everyone on any questions or any ideas to make this form flow easier with going from the provider to our staff. The second page of this, if you have gone to our website, does list all the different formulas that are available. And let's get to this. So focusing here on the top half, you fill out the patient's name and date of birth. We need a qualifying condition for why this participant needs an exempt formula. So here we have the ICD-10 code, and that's one of the questions we have on the survey at the end. The number in blue refers to the risk code that's documented in the Lewin chart that in our charting system. More details on the risk codes that are here in blue are one of the documents for the providers, and some of it can be a little bit specific. We've highlighted down here the conditions that do not qualify for an exempt formula, and those include constipation, diarrhea, managing body weight, lactose intolerance. I have another slide that I'm going to go over why some of the qualifying conditions are more clear than others. So we do sometimes, so the way these happen is a mom will come into the clinic with a completed WIC 48, or it will be faxed or emailed to the clinic. The CPA, which is a certified professional authority, is the person who certifies the family, the mom, the infant, the child. And she's the first person to take a look at this WIC 48. So she needs to decide if there is a qualifying condition and that the form is completed in its entirety, including the signature and contact information on the end. All of these risk codes are considered high risk. If a participant does have a high risk code, then they are referred to the dietitian that would be affiliated with that clinic. So each of our clinics do have a registered dietitian on staff for any, automatically they get referred if they have a high risk code, or if a mom has some concerns and does want to speak to the dietitian that's available to her. Anyway, so taking a closer look at the qualifying and the unqualifying conditions, premature birth, low birth weight, failure to thrive, are all qualifying conditions. It's the ones that don't focus on the underlying reason. For constipation, diarrhea, why does that infant have constipation or diarrhea, gas or spitting up? Some of that is just part of being an infant, being colic, having some spit up. So they're not specific conditions that would qualify for the exempt formula. Something like a milk protein allergy would not qualify because we do have for our standard formulas a soy-based formula. Same with the soy, if they have a soy allergy, the other formulas like the Advanced Total Comfort are milk-based. If a child comes in with constipation, the CPA or the RD can review several things to try to help the mom alleviate the constipation that the infant may be having. She might ask a question like, how are you making the formula? Is it made correctly? Possibly it's too concentrated. We also have educational handouts on things that the mom can do to help the child if there is constipation. And let's see. The next section, as we move down the WIC 48, it requires that the name of the formula be filled out on that top line that you see here. This can be a little bit of a pain point in a situation where a formula, this happens frequently with Nutramigen. So the Nutramigen powder contains a probiotic, the LGG probiotic. The liquid forms of the Nutramigen, the concentrate and the ready to feed, do not contain that. So we've had many of these rejected because it only says Nutramigen. It doesn't give the specifics on what Nutramigen you want for this infant. So it could often be returned because of that. Another instant is with the nutritionals. We have Neocate Junior unflavored, one with a prebiotic and one without a prebiotic. So just putting the Neocate Junior unflavored would be rejected because it hasn't been specified in details on what should be prescribed. Let's see here. So this second section here in gray, requested length of issuance. If this is left blank, then 6 months will be provided to the participant. That's the maximum amount that is allowed. And after that 6 months, a new prescription would be needed. The formula amount here, if this is left blank, it's not a problem. We'll just give the maximum amount that we are allowed to provide to the participant. Down here a little bit lower, if nothing is checked, then the infant or the child would get all of the food that's available to them on their food package. It's only if you make any marks here that the default does not happen. And you know, if you have a child past 6 months and you want them to receive only formula past 6 months, then they do get, I believe it's like 2 extra cans to make up for the decrease that happens when they go from the later months of their first year. So they get the maximum, they get what they would have gotten at months 4 and 5. Let's see here, and then the last portion, I don't have a picture, but it's where you would have to sign and sign, date, and provides contact information. And okay, so if you don't want to fill out the WIC 48, it is not required, but what is required is that we have the information necessary that, you know, we have the WIC 48 to make it easier for you. But you can, as long as all the information that we need is provided to us, either in a prescription, it could be provided on discharge notes, then that would be accepted too. We only accept the original faxed or electronically submitted. We are not allowed to accept telephone or verbal orders. And I mentioned the hospital summary is accepted if all of the required elements are available. So there are situations where we need a new WIC 48. That would be if the current one submitted is past 60 days, that's an invalid one. They're only good for 6 months, so at the end of 6 months, a new WIC 48 would be needed. It's also needed if a child is going from the infant stage, if a participants go from the infant stage to the child stage, then a new WIC 48 is needed. Also, anytime there's a change, we have either an infant or a child I was reading the comments there, shouldn't do that. So we have an infant or child that's on an exempt formula and they want to be transitioned to a standard formula. We need some documentation that that is what you, the provider, wants that child or infant to have. So there are times where, you know, we need a new one. It's not, one WIC 48 is not for the life of the participant on WIC. And the next thing we have, okay, I'm gonna go over a little bit about the ready to feed. Moms love the ready to feed. It seems a lot of them are leaving the hospitals with the new, you know, Cadillac for Abbott, which is the 360 and the 360, what's the one special? Okay, so we want to use this sparingly because the federal we want to use this sparingly because they are much costlier. We have federal guidelines. This is pretty much word for word what is in the federal guidelines. And you know, WIC is a federally funded program, so we do need justification in order to issue the ready to feed formulas. So for a standard formula, to have a ready to feed issue, we need to, the family would need to have unsanitary or restricted water supply, poor refrigeration, or the participant's caregiver is cognitively or physically unable to correctly dilute concentrated liquid or the powdered form. So a mom comes into the WIC clinic with a WIC 48 completed for, total care 360, ready to feed, even though that has been submitted by you, the provider, it would have to be rejected because that's a standard formula, and if none of this criteria fits, then it's not justified to give that to the mom. Okay, it's a little bit different with the exempt formulas or nutritional. There's 2 additional criteria that could allow that participant to qualify for the ready to feed. So first off, if the formula or the nutritional only comes in ready to feed, they don't need to fit any of the criteria. An example of this would be the Pediatric Rowe and Patty, that's only a liquid ready to feed. If that is prescribed, that would be issued. For an exempt formula, if it's determined by you that any of the criteria for the standard formula is met, they would be eligible. And in addition to that, if the ready to feed better accommodates the participant's condition or the compliance to the prescribed formula, that would be reason to allow the ready to feed. Often a mom might come in and say, listen, I've tried the powder form, I've tried, other methods, and, the child only tolerates the ready to feed, then that would be, an acceptable reason to allow that.
And really quick, so there was a question in the chat asking, are there any plans to make WIC forms available via EMR so we can more easily send them to designated WIC offices?
Okay, so the answer is yes. So for the resources that are available to you, there is a fillable form that can be saved and emailed to the clinic as long as you have that clinic's email address. I know faxes are seems like they're being phased out and they can be busy forever. So you can definitely email that to the clinic. Okay. Is there another question?
I think the question was asking about using their electronic medical record, the Epic platform or whatever.
I see.
Okay, so the answer is our charting system and Epic or all scripts are not compatible. However, if a patient or participant has access to their medical record and they go into a clinic and they call up, your medical records on whatever apps are available, they can show that to the CPA, and that can actually be downloaded into the MyWIC app, and it would be acceptable. So yeah, the 2, and I don't think this will ever happen, that what we use is LeWin will ever be able to talk to Epic. If there is a clinic that's part of a PHU, a lot of times there's a lot more communication that can go on there, and some of the WIC employees may have, may be able to, run over to the other side to get some information on a participant. But as far as the two systems communicating, the answer is no. But yeah, they can, the participant can go to their website and share that and download that into their chart. So are there any questions on the ready to feed? I know this is often a sort of a pain point or a problem point, but we just have to explain to the participant, it's really reserved for like extenuating circumstances. Okay, so I mentioned a few times the back of the WIC 48, and these are sort of divided into if a participant would go to the store and purchase it, and that would be for more the common formulas like the Nutramigen, the Pediasure. But for a lot of these special formulas, they're ordered by the clinic, and the participant would come each month and get a 1-month supply of that formula. So that's how this is divided. And you can see the asterisk here means that the justification for ready to feed does need to be met. And here we go.
All right, so I will take it over again from here. So kind of wrapping up everything we discussed today. So once again, if you have access to either your mobile device or you can do it on your desktop, if you can go to menti.com and use this code on the screen, or once again, using your QR code, and we'll keep this up the whole time for you to use. But I'll give everyone a minute or so to kind of get to that, to those 2 questions. And there's no time frame, so whenever you can answer them, so we just ask. So currently our WIC 48 contains, those ICD-10 codes. So our question is do you find these helpful on the WIC 48? Do you use them? Would it be easier if they were on there? We kind of just want some feedback from you guys whether to update that on our WIC 48 or not. And the last is just any comments or questions. If for us, and no one can see this, it's anonymous, it'll just come right to us. So if you have any lingering questions, or if you want to drop your, email for anything, we can definitely get in contact with you. So I'll kind of leave this up for a couple more minutes, but our emails on the next slide is going to be our emails on our summary information. And so like Patty mentioned a little bit, all of our clinics do have RDs on staff. And each region also has a regional nutritionist, which is kind of the head nutritionist of all of these clinics. So if you ever have, any trouble or anything like that, your regional nutritionist should kind of be able to help you. And with that being said, we can always kind of get you in contact with your regional nutritionist, or if you ever need anything from us, you can definitely just email us below. But I think,
Yeah. So another thing, a lot of moms think that WIC stops at 1 year old. It actually goes to 5 years. And the food packages that are provided, it's healthy, nutritious food. There's so many things that are being done to make the shopping experience more favorable. Just scanning an item on the MyWIC app, it'll tell you if it's eligible for you, or you can, purchase it with the WIC dollars. And
there we go.
Here's our contact information. So
yeah, so if you ever need anything from us, you can definitely email us below. And that's pretty much all that we have. But yeah, you're welcome to, if you have any other lingering questions, you can put them in the chat, or you can put them in Menti and drop your email, and we can answer them that way as well. But
or send us an email. We do get, as the formula manager, I get a lot of requests for sort of different formulas that would like to be added. And I just kind of want to explain a little bit about the process. So I got one yesterday. A mom would like their infant on a goat-based formula. There is a company that does make a goat-based infant formula. And looking into it, that company is located in the UK. That kind of brings up questions about, are the instructions in English? But the reason we would not be able to add that is we have iron requirements. I mentioned before, all of our formula, it does have iron. It has to have 1.5, I'm gonna mix up the units, milligrams of, it has to be milligrams of iron per 100 calories. This product from the UK had 1.1 of the iron, so that would disqualify it. Also, the product she wanted to purchase is not available at our authorized vendors. So to be an authorized vendor for WIC, there's, this is a federal program, there's lots of rules. So they do, there's criteria, minimum stock requirements, there's a lot of requirements to become that. So the product she's interested in is available at Target, but Target is not one of our qualified vendors. So she wouldn't be able to even purchase it, and it's not part of where we get our pricings for the formula, so it wouldn't be able to be ordered by the clinic. So a lot goes into adding a formula, and there are lots of rules that do need to be followed, so.
And really quick, we did get one question. Is there a way to get a list of updated fax numbers and emails to the WIC offices? So the most up-to-date information is going to be on our website, and it's on the eligibility page. So it is like a picture of the state, and it's broken up by regions, and they're all kind of based on PDFs, and we update those PDFs weekly. I always update them to make sure they have the most updated phone numbers and information and addresses. That's kind of where a lot of our information is housed. And so I see another question, which WIC offices have Spanish language staff on site? So I can't list, so the short answer is we don't know which ones specifically have bilingual staff. There are a couple in Region 2. I really can't list the ones like where they have bilingual staff, unfortunately. However, we do use Language Line in all of our clinics. So all of our clinics have access to Language Line through their phones, or there is a video option as well that they can use. That's kind of how we communicate with our limited English proficiency participants. Okay, so I guess I answered the second one too. So yeah, so we use Language Line is the short answer to that question, and we are always translating. Kind of another thing that we want to kind of do for participants is make sure all of our resources are translated into multiple languages. So we're always translating them into new languages. Everything we put out is in English or Spanish. So let's see, what should a family do if they go to, and so every clinic does have access to Language Line. So there shouldn't be a clinic that doesn't use Language Line. Now we've had some issues in the past couple of weeks where there was a mix up with the phone numbers of Language Line. However, we just kind of circulated a new Language Line number that just went out to all of our clinics not that long ago. So they should have the most recent Language Line number and access to Language Line. And all clinics, we are currently in the process of sending out new computers and phone and certain different phone lines for participants.
So Rachel, I'm reading what you wrote there, and I'm sad to hear that, but it is a requirement that they do use the Language Line. If something like that happens on our website, they can, and you can do it also, file a complaint or concern or a compliment. Let us know as much information that you may have, as far as the participant's name, what clinic it was. What I hear happens is if in the Spanish community, if they know there is staff on site that is, bilingual, then a lot of times that word spreads through the Spanish community. I know in Kenner, there is a Spanish bilingual woman that works there. So Kenner has, in Region 1 has, a large number of Spanish participants going there. Can they file the complaint in multiple languages?
Yeah, so I'm looking that up right now. I'm pretty sure our shopping complaint definitely is in multiple languages. I think they're currently in the process of translating the current form, the complaint form that we currently have, into Spanish. So pretty much Spanish is really one of the only languages that we are everything is definitely translated into Spanish. Yeah, we're currently in the process of translating into other languages like Haitian Creole, Portuguese, Brazilian, Arabic, and Vietnamese are kind of our languages that we're translating into. Elizabeth, thank you. So yeah, the Covington Clinic and also has bilingual staff. It just depends on kind of the clinic resources and who they can kind of hire if they have the the bilingual staff. But
it'd be great if everybody had bilingual staff.
Right, yeah, that's the goal eventually.
Now, a participant can come in with a Spanish speaking, I think they have to be over 16 years old that can do the translation if necessary. But our program guide, all of our handouts are available in Spanish. And the website's been really revamped to accommodate Spanish participants. So WIC is not just formula, we just do a whole lot. Breastfeeding support, promotion. So,
are there any other questions? I'm kind of monitoring anything, but I think if there are any other questions, just let us know. But thank you guys for kind of giving some feedback. It really helps us to kind of do our jobs and, make sure the WIC 48 looks, is easy for you guys and is easy for participants. That's kind of our goal, so.
Yeah, I'm also not seeing any more questions come through. Everyone make sure that you complete your evaluation. It is the evaluation link is on the screen, and the QR code. This is required if you want to receive CME credit or an attendee certificate for this activity. But also we strongly request that even if you don't need credit, you go ahead and take the evaluation. It helps us to continue to improve and make sure that we can give feedback to our presenters. Also, keep an eye out for more information on our next Pediatric Gumbeaux webinar. Details are being finalized and will be shared out soon. And then on February 27th, we will have Boosting Public Discourse, Evidence-Based Strategies for Reframing Child and Adolescent Immunization. This webinar will be in the evening and presented by Julie Sweetland from the Frameworks Institute. And I will drop that link into the chat, and you could also scan the QR code. Our next conference will be August 16th through 18th in Alexandria, and proposals for the conference are due tomorrow. If you're interested in submitting a proposal and haven't had a chance to look at that yet, you can reach out to me to discuss a extension if necessary. And you can see more about the conference. I don't remember adding that. Okay. At laap.org/2024 potpourri. Finally, all of our webinars are recorded for on-demand viewing and credit. You can access this webinar shortly, and then other free education from the Louisiana AAP on our YouTube channel. And then make sure to subscribe there to keep up to date on new on-demand webinars as they become available. Okay, thank you, Ms. Rowe and Ms. Abraham. I will give us a couple more seconds on the evaluation form, and then have a great day, everyone.